Today we're going to add on to some exercises that I've been introducing you to re-educate the deep stabilizing muscles of the spine. So that includes the more well-known multifidi, as well as the intertransversi, the muscles between the transverse processes along the spine, and the interspinalis that connect each spinous process to each other. And we know how important these muscles are when it comes to low back pain. And if they're not re-educated, reactivated, re-strengthened, then we can have an old injury that just lingers and never seems to fully heal. It's not that the tissue hasn't healed, it's that the muscles haven't been retrained after they've been traumatized by the back pain. And we know with studies with multifidi that within 24 hours of the onset of low back pain, they will begin to atrophy or waste. And so of course that means they lose their strength and their ability to keep the spine integrated, and this of course results in pain. So this exercise is done on a fit ball. When you're using a fit ball, it's important that when you sit in a neutral position, that your thighs are parallel to the floor. So this is quite a small fit ball, but it's the perfect height for me. We're going to, of course, sit upright with a long spine. That means a heavy tail and lengthening up through the crown of our head. And you need to find your neutral pelvis. So that's halfway between your extreme posterior tilt and your extreme anterior tilt. So find where there's the least amount of tension for you. And I'm eventually going to ask you to do this exercise without your hands on the pelvis. But for now, I'm going to have my hands there so you can actually see the movement of my pelvis. The movements are small. They're always small, slow and controlled when we're trying to re-educate, especially deep postural muscles within the body. So we're going to start with pelvic tilts. And so you tilt the pelvis back and you tilt it forward. And I'll do it from the side so you can see it a little bit more clearly. So we tilt the pelvis back, we tilt it forward, we tilt it back, we tilt it forward. And sometimes when the muscles in the low back are very tight, this actually feels like a little bit of a stretch and an opening, and that's okay. That's actually quite good. So we're tilting the pelvis back and forward, but what I'm not doing is involving the rest of my body. So I'm not doing this and this and this and this. In fact, what I usually tell my patients or my students that I'm teaching this to is that pretend that you're at dinner and you go, oh damn, I forgot to do the exercises that Monica told me to do. And so you're going to do them underneath the dinner table, but nobody can actually tell that you're doing them because you don't even move from the waist up. So this is really focusing on the low back, the pelvic area, and you'll feel that even the deep muscles in the hip actually have to engage. So after we've done our forward and back tilt, we do a side to side tilt. So it's just hiking one hip, hiking the other hip, hiking and hiking, and then come back to neutral. So remember to keep a neutral pelvis that you're working from, and now we're going to draw a circle with the hips. So it's a small movement, and it's me drawing that on the fit ball, and again not moving from the waist up. You may be able to see that, and then reverse it in the opposite direction. And this is basically connecting what we just did with a front tilt, a side hike, a back tilt, and a side hike, and everything in between. So we're really having to use those muscles in every way that they can move. I call these deep stabilising muscles your groovers, because they enable you to do that shimmy, shimmy sort of groovy moves. They're not like the big movers, but they're the deep groovers. So we're going to groove a little bit more, and this time what we're going to do is imagine a figure of 8 that was down, that you're looking down into it, and you're going to try to draw that. So you're going to go forward. The centre of the 8 where it crosses is your neutral pelvis, and you're going to go back. And again, I'll pop my hands back on my hips so that you can see it. Forward and back and forward and back. And then we'll reverse. Now you may find that there are just parts of this figure 8 that you're finding a little bit difficult to draw. And you may want to just retrace that little section. Just retrace it back and forth and back and forth, because this is probably the area where your multifidi are maybe not kicking in. So you need to be very strict on yourself. Maybe you had one of those teachers in primary school that made you draw it perfectly with your hand, and I'm asking you to draw it perfectly with your hips. So now we're going to do one more variation, which is a infinity sign. In other words, a figure of 8 lying this way instead of upright. So we draw that right and left. So we're going front and side and back and left, front and side and back. And just this nice swaying motion that involves not only the muscles in the low back, but also means that we're mobilizing the sacroiliac joints and the hip joints, and reverse it. And sometimes it feels really weird to go in the opposite direction, but it's a great activation for all of those muscles. Good, and just to finish off, we're going to just bounce on the ball. You can do this as a little warm-up to start, and this is really great for the intervertebral discs, because our discs require movement. They actually have the nature of a sponge, where they require this compression, retraction, action in order to be imbibed with moisture, hydration, nutrients, and removing toxins. So this is the way that our avascular, without blood vessel, tissues are actually hydrated and nourished with movement. Hence the saying, motion is lotion for our joints. And just this gentle action of going up and down on the football is a really nice gentle way to imbibe those intervertebral discs. So here's to the health of your spine, your body, and therefore your mind. Namaste. Thank you for joining me.